Hello everyone, welcome to our seminar on maternal mental health. My name is Dr. Andres Fonseca. I'm a consultant psychiatrist and I'm also the CEO and co-founder of Thrive. And I have with me Alyssa McChris, who's one of our business psychologists here at Thrive.
Hi everyone, thanks for joining us today.
I think the session will take approximately 45 minutes and then we'll have 15 minutes for questions after. There's a Q&A function that you can find and then you can submit questions. And as we will be alternating in the presentation, if there's any burning questions, we'll be bringing them into the session. If not, we will just answer them all at the end. We're recording the session, so we will be making it available later for your colleagues that maybe weren't able to join us, and for yourselves if you want to review it yourselves. So mental health conditions related to pregnancy and childbirth are an important topic given their frequency and impact. If you think about the frequencies, about 20% of pregnant women are affected, and every year there's around 140,000 people in the UK. So in terms of impact, in addition to the effects on the mother's health, the ability to function and the level of distress, these conditions can also affect the infant and also the family at large. So I think this is a summary of the things that we will be covering. So we'll be trying to answer all those questions so as I said, feel free to sort of bring in questions if you think of anything as we go along. So if we look at conditions that may happen during pregnancy, the most common conditions are depression and anxiety. Depression a little bit more common than anxiety, in fact. But depending on the survey that you're looking at, also adjustment disorder is highlighted as being very frequent. In fact, when adjustment disorder is reported, it is the most frequent mental health condition in pregnancy. And if you haven't heard the term before, adjustment disorder is characterized by having a significant difficulty adapting to one or more life events or stressors. And examples of that might be things like divorce, having an illness, or being diagnosed with something, having financial problems, things like that. And the symptoms usually start within a month of the event that triggered them. And the person affected is excessively worried about the event and its potential consequences, being unable to stop thinking about it. The difficulties adapting make it very hard for the person to function and can lead to severe distress. And these symptoms are normally not severe enough to justify other diagnoses, or maybe they are, but they're too short-lived to make it into other categories. And they typically resolve in 6 months, but they can be risky for the person during the acute phase. Of course, in some circumstances, I should say, what starts off as being classified as an adjustment disorder can then become something like a depressive episode or an episode of anxiety. And I bring this up because pregnancy and childbirth, as we will be discussing in the session, are particularly powerful life events, as they have all the characteristics of all the major life events in terms of their potential implications, but they also have the added impact of the biological changes that they carry. So it's worth noting that a life event does not need to be quote unquote negative in order to increase perceived stress. And if you look at the surveys and the evidence that that the research into perceived stress that we have available now, some powerful life events include things like graduating from university or graduating from school and going on to university, getting married, moving away from home. So not necessarily negative life events, and they still can have an impact. So during pregnancy, the prevalence of depression, anxiety, and other conditions does not seem to change as I've got there. The thing that seems to, the diagnosis that seems to be more frequent at all the times is potentially adjustment disorder. However, one important consideration during pregnancy is that women who are already on medication for a mental health condition may need to stop it. And this is something that needs very careful consideration and discussion between the woman and her psychiatrist or health professional. And this is always specialist territory. Although there are some experienced GPs who have a special interest in this area that may be well placed to also discuss it. So if we look now at conditions that may affect women in the postnatal period, during the postnatal period, the risk of severe mood disorders is indeed increased. And this may be linked to hormonal changes, as we might see later, but it's also important to note that social and psychological factors play a very large role. I think Alyssa will go into detail, describing those. Now, there is so the thing to know about this is that it seems to be that mainly the risk is driven by these other factors rather than necessarily any major changes. There is one particular set of circumstances where the hormones may play a larger role. I will discuss that later. So not having access to reliable, good quality support during the postnatal period seems to be perhaps the strongest risk factor, and also having difficulties with one's partner also markedly increases the risk. And other risk factors include things like number of previous episodes of a mental health condition, or having previously experienced a mental health condition in pregnancy. So in general, like any mood disorder, this presentation is best understood as a range of risk and protective factors that all kind of interplay and interact with each other and culminate in triggering a mood episode in the context, in this particular case, of a biological state. So there's a special case to be made about psychosis. So some of you may have heard the term puerperal or postpartum psychosis. And psychosis in general is characterized by the presence of delusions, which are fixed false beliefs, hallucinations, which are perceptions without a real stimuli in the outside world, and other symptoms that also interfere with a person's ability to perceive and evaluate the world around them. That's kind of a definition of what a psychotic syndrome might look like. So women with previous history of a psychotic condition, such as schizophrenia, may be at a particular high risk of having a new episode during this time. You might expect this. And women can also experience a first-time psychotic episode abruptly after giving birth. This is what's specifically called this condition postpartum psychosis or puerperal psychosis, which is is probably best understood as this first-time episode that I'm talking about. So it happens in 1 or 2 cases per 1,000. And women with bipolar affective disorder may, or that later on go to develop bipolar affective disorder, may have a greater risk. And so do those women with a family history of postpartum psychosis. However, very important to note that around half of the women who have this postpartum psychosis don't have any known risk factors at all. If it does happen, it is an emergency that requires urgent attention, as it carries risk for both the mother and the infant, of course. The mother can have mood symptoms, can have delusions, as described above, or hallucinations. The mother can have confusion and a fluctuating, rapidly changing cause. It's very important to exclude any other causes of this, because this kind of a presentation can happen with, for example, a serious infection or any other serious health conditions that affects the whole organism, the whole system. I suppose it's very important to not just assume because somebody's presenting with symptoms like these or similar to these, that they are having a postpartum or puerperal psychosis. It's important to investigate all the causes. Now, I'll hand over now to Alyssa to talk a little bit more in depth about the causes.
Mm-hmm. Okay, so I'm going to quickly touch on why does it happen. And as Andres has mentioned before, maternal mental health difficulties are significantly common, as pregnancy is a particularly powerful life event during which a mother has to adjust to a variety of significant changes in her life. Maternal mental health difficulties are diverse and complex because they can present differently in each woman. There are a variety of risk factors as well as protective factors, which Andres has mentioned before. These could be social, psychological, or biological aspects, which can influence the likelihood of someone having a mental health complication during or after their pregnancy. So I will be talking a bit about the social and psychological aspects, and then hand over to Andres, who will talk a bit more in depth about the biological aspects. So the social aspects are external stresses, which can have a positive but also negative impact on the mother during and after her pregnancy. Often these can be complications that you will have no control over, such as maybe the lift breaking down in the block of flats that you live in or having noisy neighbors. Other times it can be aspects which you can change, such as the social support network that you have around you, for example, nurses, family members, friends, and so on. So to begin, I will be talking about the importance of having a supportive partner, because research has found that women who had access to a supportive partner or other confining relationships are less likely to experience maternal mental health problems, emphasizing on how important it is to have people around you that you can rely on, or just in case you might need anything or need someone to talk to. Facing significant life changes alone is extremely challenging, so being able to share your experiences with others or ask for advice can be crucial for better coping with stressful or uncertain situations. Your social support network does not necessarily only need to come from your partner or family. Some women may not have access to these types of supportive relationships, but that still doesn't mean that they have to go through this pregnancy or motherhood alone. Professional support networks such as nurses, midwives, doctors, counselors, they're all available to support, as well as new mother groups, which can help a mother to feel more looked after and more at ease. Also, not all this is necessarily needs to be used all the time to have a positive impact on someone's life. Just knowing that this is available to them is enough, really, to build the resilience and reassure a person that help is there if they do need it. This now brings me on to the next point about the larger social context and how society is set up where the mother lives. This can include employee policies on maternity leave, support when returning to work, and support for financial well-being. If these policies are recognized and implemented, they can have a positive impact on a mother's sense of security, as she will feel reassured that she can take time to take care of her child while feeling financially and socially supported. So eliminating some of the extra external stressors that mothers may face during these times, especially for single mothers or mothers who are in the process of building their career. Also, unfortunately, some parents may be facing some discriminatory behavior from others during these times. Many societies and individuals have strong views about what is appropriate or inappropriate, what is right or wrong, what is best for the child, etc. This societal stigma can be around marital status, as sometimes societies emphasize on the importance of getting married before having a child, or stigma about the sexual orientation of the parents. For example, when a gay couple would like to adopt a child or have a surrogate. All these external pressures can be exhausting and stressful to cope with. However, as time passes, we're slowly moving towards a more accepting and inclusive society. So that doesn't mean that the stigma has disappeared or will completely vanish anytime soon, but it is a work in process which will evolve over generations and take some patience and education. Andres has also mentioned to me that his wife had to put up with some negative attitudes about her wanting to return to work after having a child. Andres, would you like to share a bit about your wife's experience?
Yeah. So my wife is a career-oriented woman, and she's always wanted to return to work shortly after. So the first time it happened, obviously, was after the birth of our first daughter, and she's always been quite devoted to her career and has found it hard to stay indoors at the best of times. So knowing this, we made arrangements so she could go back to work after 3 months. So her work was actually very flexible, even though we expected some resistance. As you know, they needed to accommodate some adaptations for her during this period. She works in construction, so actually it was very welcome that they took such a good and progressive and proactive view of the whole thing. The thing that she noticed the most was the comments from our own families and friends. So the comments were about how good a mother was she really, going back to work so early, perhaps not breastfeeding for longer. And one thing that we heard was like not focusing on the child's development. So obviously during this time, it happened with our second daughter as well, I took on some duties. But when I did this, I only received praise for my part. I was never judged for going back to work myself. And whatever I did, it was always received with admiration, which I mean, I felt it was terrible at the time. I even feel worse about it now. But whatever she did was never like good enough. There was some, comments that we heard, kind of had a tone to portray her like being selfish or that somehow she was doing like the wrong thing. And I think we need to support mothers who want to go back to work. And we know that good quality attention and affection from caregivers helps babies, but this is not all on the mother. Why should it be? So, hopefully these attitudes will change. So women don't feel themselves guilty and are not made to feel guilty for doing things like that.
Yeah, it's so important that it's not just the mother's responsibility solely to care for the child, that there's a mix of different social support around that the mother can rely on in order to still continue doing what she values and has the support around her. I'm going to go into talking a bit more about psychological aspects now. So, in terms of psychological aspects, these can be the experiences that we have been through in our lifetime. These can influence our personalities, our views about ourselves and the world around us, as well as our levels of resilience to stressful or uncertain events. Early experiences, especially upsetting ones or traumatic ones, such as the loss of a parent before the age of 11 and neglectful or abusive parenting, have been found to be significant contributing factors to later experiencing mental health complications during pregnancy and during motherhood. But also recent experiences, for example, even this pandemic, can significantly influence and increase feelings of anxiety and stress. However, these significant life experiences, especially the more challenging ones, can help to build our resilience. If we're able to identify how our perception of certain situations influences our stress levels, we can change our perspectives to more helpful ones, allowing us to cope with them in a better way. So this brings me on to the next point about stress perception. It's really just about realizing that we can learn valuable lessons and gain new skills from these experiences, which can help us to cope better with future stressful experiences, such as allowing us to have a higher stress threshold in the future, allowing us to cope better. Women who experience mental health difficulties often also have a negative view and judgment about themselves. This can negatively affect their self-esteem. So by internalizing this self-stigma, it can lead them to believing that they will not be able to cope or that they will be a bad mother, seeing themselves as failures as they might compare themselves to others or set their own standards way too high. It's important to be able to self-reflect on these unhelpful thoughts and change them to more helpful ones in order to see the values and qualities that one has, which are more than enough, but also to come to acceptance with the fact that sometimes we do make mistakes and sometimes we cannot handle everything, but to really set our limitations to be more realistic. So, this self reflection and acceptance can be learned through psychological coping strategies such as CBT or mindfulness techniques such as meditation, which I will be going through in a bit more detail later on when talking about prevention of mental health difficulties and how to build your resilience. For now, I will hand back to Andres, who will talk more about the biological aspects of maternal mental health.
Yeah, so it's actually been quite hard to quantify the specific effect. If we start with hormonal effects, potential hormonal effects, the specific effect of hormonal changes, which may have on developing this type of perinatal conditions. As we've seen, the causes are complex and involve a great number of different factors. So teasing out the role of hormones is actually very challenging. The current state of research suggests that in a particular subset of women with a very specific presentation of postpartum depression, so pure depression in women who perhaps never had an episode before, that starts in the days or weeks right after giving birth, in these women, there is sufficient evidence that reproductive hormone fluctuations can have an effect on mood regulation, but only in this group of susceptible women. However, even in this select group, it's not clear whether the main contribution to risk is correlated with changes to the reproductive hormones or other changes that also happen to stress hormones directly, or the immune system, or hormones that trigger the production of breast milk, for example. So this is an active area of research, but at this time, there is no established hormonal treatment for even this specific group that I talked about of particularly susceptible women. So, I mean, it potentially leads me to think that the specific effect of reproductive hormones may be overestimated in people's minds. So I've already spoken about the risk factors associated with having a previous episode of a mental health condition, and having a family history of these conditions as being important. So that's kind of another biological contributor, perhaps even more powerful than these hormones in this particular group of women. So because of the nature of these conditions, they tend to recur, and they recur particularly during times of stress. And as we've been discussing, it's not surprising to see that there's a link. This is a particularly powerful stressor, as we were talking about. And remember that stressors can be positive or negative. So having a birth in the family may be a very positive change, but also is a powerful stressor in many ways. Also, from a biological point of view, chronic health conditions can increase the risk of having a mental health condition at any time. And during pregnancy and in the postnatal period, it's even more likely. And this is for a mixture of both psychological, social, and of course, directly biological reasons. Chronic pain increases the risk of mental health conditions in general, but combined with pregnancy or the postnatal period, it may be enough to trigger an episode. Finally, and this is probably the thing that I want to emphasize the most, poor sleep is a factor that increases our risk of both physical health and mental health conditions, and pregnancy and having to care for an infant, particularly without support, may frequently result in poor sleeping patterns, which themselves add to the risk. So all of this is to say that a health condition, pain, or poor sleep are definite contributing factors. And all of these may have also been developed during pregnancy as a direct result of the pregnancy. If you have a complicated pregnancy, something like eclampsia or other conditions related to pregnancy, diabetes related to pregnancy, or as a consequence of a complicated birth. And they need addressing in themselves, and they may require additional support from others. I do want to talk a little bit about the impact on the infant. So a lot of mothers worry about the impact their mental health condition will have on an infant. It's a fair concern, but in my experience, many look at themselves as the sole source of the problem, which is, again, in my opinion, completely wrong. So if you look at what infants require, is to have the questions that are on the screen kind of answered with a resounding yes. So can I rely on the people that look after me? Can somebody soothe me and help me learn how to soothe myself? Will somebody help me when I need something? So nowhere it says that this needs to be the sole responsibility of the mother. And in fact, it shouldn't. Think about it this way. If a mother had a debilitating physical illness, do you think she should feel guilty about having the baby being cared for others in that situation? So if she had to go through major surgery, or maybe she's got cancer and that needs treatment, something major like that. So do you think also that the baby would be adversely affected if others were looking after the baby while the mother is recovering? Well, this is no different. It's a majorly, one of these conditions can be majorly disabling in many ways. So the best thing for the baby is that the mother focuses on getting help and getting better. And while that happens, we know it's a good idea for both the mother and the baby to maintain as much contact with the baby as the mother can, but importantly, no more than the mother can. So should not put undue pressure on the mother, as this is not beneficial for the mother and not beneficial for the baby either. So having other reliable caregivers is just as good for the baby and quite important for them as well. So even in the best of circumstances, the mother is going to need a rest, and having other reliable caregivers is very important to afford the mother these rest periods. I'm going to hand over now to Alyssa to talk a little bit about prevention again.
Yeah. So essentially, prevention is about working on resilience and learning skills that can help the individual cope better with significant life events or changes. So a good place to start is usually through psychoeducation, which is basically what you're doing right now, learning about mental health, what it means, how it presents differently in individuals, how it develops, and where to get help. Through psychoeducation, women have reported feeling better prepared and less frightened, as well as more able to seek help or support. There are also a number of psychological coping strategies you can learn on your own in the comfort of your own home or when you find some time to yourself. These are coping strategies which will help you to build your resilience to stress by helping you to gain control of your thoughts, allowing you to relax your mind and your body. For example, cognitive behavioral therapy, CBT, has been shown to be effective at preventing common mental health disorders such as anxiety and depression. CBT helps you identify those negative or unhelpful thoughts that you might be having about yourself or a particular situation and change them to more helpful ones, allowing you to have a more constructive interpretation and improving your overall mood. There are also a range of mindfulness techniques such as meditation, calm breathing, deep muscle relaxation, and more, which are life skills that can be learned for better management of one's stress response. Meditation helps us to self-reflect and really come to acceptance with any thoughts or sensations that we might be having about ourselves or a particular situation and let them go. While calm breathing and deep muscle relaxation can help us to calm down our body when we might be feeling fight, flight, or freeze symptoms in stressful situations, such as the shallow breathing or increased heart rate or upset stomach that you might be feeling. This allows us to get a better understanding of the mind-body connection, helping you to calm down your mind by relaxing your body. Other ways to build resilience is through using or expanding one's social support network. So health visitors, nurses, and other community health staff provide listening visits. This is a time dedicated to visiting new mothers and to listen to how she's getting on with her new role, difficulties she experiences, experiencing, how she is feeling about herself, her new identity as a mother, and her relationship with her new baby. So the focus of these meetings is really not to find a solution or take action, but to hear about her experience and to validate her feelings. Providing a listening ear can really help a mother to feel supported so that she can feel more better to cope or find solutions. Other social support networks that are available and can improve a mother's mood and reassure her that she's not going through this alone are exercise classes for pregnant women or baby/toddler groups or new mother groups. So sharing one's experiences can help to lighten the load as well as find solutions to any challenges that the mother might be struggling with. If a mother has a pre-existing mental health condition, this really shouldn't hinder her from starting a family of her own. However, it's important for her to keep in contact with her healthcare provider and talk about her pregnancy so that they can create a care plan together. So Andres, would you like to tell us about the patient with bipolar affective disorder that you looked after?
Yes, there's a question as well that this might be relevant to, so I'm going to attempt to kind of answer the question as well as describe what happened. So yeah, so I had a patient who had been my patient for a few months. I took over her care, so she was a known patient in the service, and she was very stable, and she had been stabilized on medication. She had bipolar affective disorder. Bipolar affective disorder, if you remember, is one that has probably the greatest risk of relapsing during the postpartum period. So it can be both present as puerperal psychosis or postnatal depression. So both are increase in risk. So she wanted to get pregnant, but she also was aware of the risks that this carried. So she brought the issue up with me a few months before she even started trying. And we designed a plan together to come off the medication and undergo increased monitoring in the clinic and with one of our nurses. So as soon as she got pregnant, we also including her obstetrician and her midwife into our plan. Unfortunately, it all went well, and she did very well to involve all of us so early in the process, so we could have all the support in place for her, and also sort of, for example, do when she was coming off the medication, do that very carefully. So it's likely that I think the additional support that we put in place contributed to greatly reducing the risks. She was probably less stressed and kind of had a very good idea of what was going to happen at each step of the way, and who she could rely on. So I think she was probably less stressed than maybe even other mothers, because we had a very solid support network going on around her. And she didn't have a relapse. She was perfectly well. She went back on the medication after giving birth, and we used no medication during this period. We just purely focused on psychological and social interventions. The question is about whether if a mother suffers from a mental health condition during pregnancy, can this increase the risk for the baby? And the answer is that it depends. So you will attempt to minimize. Of course, it does carry some risks. It's a similar question to if you have any physical health condition and is not properly managed during pregnancy, does it carry risks for the baby? And the answer is often yes, it does. What you need to do is to do something like what I described to minimize those risks, not just for the baby, but also for the mother. So yes, I mean, in that question, also I would say that the mother is missing. So her risk is increased by this life event, and we should take that seriously. And of course, the risk for the infant is consequently is increased, but we need to take both into account. So we want her to be well, and we also want the baby to be well. So doing things like this planning, making sure that we minimize all the risk factors is going to be very, very important. Now, if it does happen, there are ways and means that you can intervene, like we will see later, to minimize those risks. But yeah, so the short answer is that yes, if you're very, if unfortunately you have a condition that increases that a mental health condition or any other health condition that is not properly managed during pregnancy, it can increase some of the risks for the baby. Yes.
Yeah. So this brings me on to the next point about help seeking and the challenges that a lot of women might face with seeking help, or why it can be difficult to identify any mental health conditions. So it can be difficult, as mentioned before, to identify because they are often overlooked or misunderstood or ignored. Some of the main reasons why it is difficult to detect and recognize is because there's a stigma associated with mental health. People might get treated differently if diagnosed with a mental health disorder, or they might feel shame or self-doubt. This is mostly due to a lack of understanding of a disorder and can be reduced through awareness and psychoeducation. Sometimes also cultural expectations of motherhood can play a role in parents accepting or recognizing mental health disorders, as motherhood is expected to be seen as something that is fulfilling and brings happiness or a sense of purpose to a mother's life. However, feelings of motherhood are often more complex than that, as there are many new challenges that need to be dealt with. Often because of these expectations, new mothers put on a brave front so that they might feel that others will judge them or see them as incompetent mothers. In the worst case scenario, they might fear that their child will be taken away from them. However, by trying to suppress these feelings and worries, they could get worse over time, and by not addressing them, sometimes we might not be able to cope with everything by ourselves. So we really need to be supportive of each other and encourage each other to seek help, as well as let each other know where this help can be found. And this then brings us on to the available interventions that there are for when somebody tries to seek help.
Yeah, so we've explored the causes and how to prevent these conditions linked to pregnancy and particularly childbirth. I don't think it's going to surprise you that we're going to follow the same pattern with an emphasis on using things that are not medication. Of course, depending on severity, it might not be possible for the woman to take advantage of psychosocial interventions. In that case, we can be reduced to using suitable medication in a safe environment in the first instance. So there exists mother and baby units. I've worked in a few for such situations, and they're geared towards keeping both the mother and the infant safe, but also to be able to, so they're able to interact with one another while enabling the mother and the baby to receive quite intensive additional support. So psychotherapy, we've already seen the role of some forms of psychotherapy for prevention, but it also has a definite role in when we're treating one of these puerperal or pregnancy-related conditions. So this can be focused on the mother, like CBT, we've heard that, but also can be focused on the couple. We've seen the importance of a supportive relationship, but can be focused also on the larger family. Again, this network that we're trying to establish, this supportive network around the mother, is an important risk factor, and it's an important key to helping a mother recover as well. So a particular form of therapy there that addresses the larger family is called systemic therapy. Peer groups, this is when we're talking about treatment, there might be a peer group. So these are women who are affected by one of these conditions, and they are getting together. They can be very useful, but we know that when somebody has one of these conditions, they do need to be supervised by a trained therapist for it to be effective. So it always sounds good, like a good idea to talk to others that have gone through what you've gone through, but we know that without that supervision element, it can be ineffective or even backfire. So it requires that element to be effective. And if it does have it, it's actually pretty effective. It's very good. In terms of social interventions, if the woman has a history of mental health conditions, it's important to strengthen all the support available, like the example that I gave with the lady that I treated with bipolar affective disorder. So we included a community psychiatric nurse, a midwife, We included the obstetrician. We included a number of professionals, a good, robust network around her. And we also included her family at large. Also, there's an important role in detection and early intervention for health visitors. So they have that role of being a listening ear, etc. But also they can be a way to do early intervention here. Liaising with employers, we've seen the importance of having the employer on board because of that financial stability, that, you know, reducing the stress on the mother, knowing that she doesn't have to worry about that aspect. This is very important. So pregnancy and childbirth, they're already very high impact life events. We need to minimize all other potential life events, or worry about all other potential life events that may happen. So stress from employers and worrying about one's career is not what you need during your maternity leave at all. So in some cases, it might be necessary to involve social services early. So this is usually carried out by the health professionals involved in the care of the woman. It could be also on the health, on the obs and gynae side. So an obstetrician and gynecology service might opt to do this if it's necessary. In terms of biological treatments, I've already said that there's no current hormonal strategy in place for the reasons that I mentioned. It's unclear how it actually works. So we tend to use at the moment the same kind of medication that we use in other circumstances. So whatever is indicated for the condition that the mother is presenting with. The good news is that the rate of response is comparable to that of individuals in other situations if we control for all the risk and protective factors that we've been talking about. So during pregnancy, there are some medications, very few, but some that can be used at certain times safely. But this is always a specialist area and requires the collaboration between mental health and obstetricians and gynecologists. And also it requires careful liaison with the GP. Every case is quite unique. So there are no hard and fast rules there. You do require that specialist input. In the postpartum period after childbirth, medication can be used, but always comes the question of breastfeeding, which is another area where women can sometimes be made to feel like they're failing the infant somehow, which is again another big problem. It is not helping the mother and is not helping the infant to be made feel like this, So there are some medications that can be used safely if a mother is breastfeeding. Sedative effects from the medication can be an issue, as mothers may fall asleep. They're already sleep deprived, so they may fall asleep during nursing, which could put the infant at risk. So there's something to be thought of there. So it might be important, for example, to time the medication to take into account breastfeeding times. Again, this is a complex area and it requires specialist input. I should also say that infants do get an advantage from breastfeeding, but I think it's overstated, exaggerated at times, which has the effect of making mothers feel terrible if they cannot breastfeed for whatever reason, which I don't think is good for anybody here. So some of my patients have refused to even take medication at times due to this, which can result in an increased risk of becoming unwell. And I think the risk-benefit analysis may be complicated, obviously, but in general, the baby will benefit more from having a healthy mother than from a mother who's struggling in order to try and maintain breastfeeding, if that makes sense. So there we go. I think, yeah, so should we do a bit of a recap then, Melissa? Yeah, do you want to have a go at doing a recap there?
Yeah, sure. So we talked about the different aspects of maternal mental health and what the risk factors are, as well as what can reduce the risk of developing mental health. So the importance of social support networks, such as having a good partner, but it doesn't necessarily need to be somebody within the family members, or it can also be professional support network around you, such as nurses and so on, as well as the broader social context, such as maternity leave and financial well-being. And we talked a bit about psychological aspects, which can be where you can build your resilience and be able to prevent mental health conditions from developing through CBT and mindfulness techniques. And Andres, would you like to talk a bit about the biological factors?
Yeah, so and again, to also recap on the intervention side. So the intervention follows the same kind of model, this biopsychosocial model, with an emphasis on the biological and with an emphasis on the psychological and the social, as we've said. So strengthening existing social support, but also increasing social support, and also enabling the woman access to learning these psychological techniques, which can be very useful skills in prevention, but also in the treatment. In terms of the biological aspects, one thing that we mentioned was the effects on the infant, and that the support may come from not just the mother but others. The effects of using certain medication during pregnancy is a complicated area. Most of the time, women do have to come off the medication, and when they are lactating, when they are breastfeeding, there's more medication that can be used, but also it can be tricky, and it's another specialist area of prescription. But in general, yes, is trying to very hard not to make mothers feel like it's their sole responsibility, and make mothers feel supported, and reducing all other stresses because they have a lot. Also, I do want to sort of remind people of the importance of sleep, and how you're going to get good sleep by having good breaks and having good support, having some other reliable caregivers around you that can help you get that crucial sleep, which is a very powerful biological risk factor here.
Yeah, as well as being aware of the stigma that might influence help-seeking behavior, and being able to support people in that sort of way, and being sensitive to that.
Yes, absolutely. Yeah, well, thank you very much. We'll open for some questions. I think we've answered one already. There's one question about miscarriage. Miscarriage is also quite a complex area. We haven't addressed in this seminar. It's actually, I'm tempted to suggest that this would be worth its own seminar, because if you look at bereavement in general, that is a subject unto itself, and this is a particular form, depending on what the circumstances around the miscarriage are. It can be exceedingly distressing, and a difficult life event to cope with. It's got many aspects. It's got similar aspects to this, in that is perhaps even more powerful life event, with also the same biological context that we've been talking about. So, but it does have some of its own intricacies. So I don't feel that we can do it justice without spending some time in it. If there's a demand from the audience that we could do another seminar looking at specifically at miscarriage, I think it would be worth doing that. Yeah.
Yeah, I think that was the only question for today. If anyone has a question, please feel free to type it into the Q&A box. We'll wait a couple of minutes in case somebody wants to ask something.
Well, I hope that was useful and it was clear. As I said, if you want to share the recording with anybody, we'll make it available to anybody who signed up and attended. So we'll notify you when that is available. It usually takes a couple of days.
Yeah. So if there's no more questions,
I think we'll end it there.
yeah. Thank you all for joining us today.
Thank you.